Hey guys, welcome back to Medical Coding with Blue. Today is going to be Urology Q A. It is going to be all about urology, but there's just a couple of things that I want to talk about beforehand. Today was just one of those days that there was a lot of annoying things that happened, and it wasn't really work related, it was just other things. And then the culmination of all of it happened when I nearly had a front end crash. So, nobody likes to be in an accident. Nobody wants to be in an accident. But one of the things that annoys me is when somebody nearly hits me. And so I'm at the stop sign, right? And I'm waiting to go. And I see this lady, she's about to turn. And she nearly turns like into me. Like literally she's turning it. And like if I hadn't hit the horn, she would have hit me. And like I don't know if it just woke her up or if it made her start paying attention, because then she moved and she nearly missed me. So I love my car. I have a cute little sports car and her name is Sasha. Yes, I have named my car Sasha. I'm one of those, yes. I've always had a car for utility, never for beauty. She is the very first car I've ever had for beauty. And the thought of something happening to my car literally makes me crazy, because I take very good care of my car. I take a lot of pride in my car. I park her far away. I don't park her near people, because people don't care. They just, want to open their doors and just hit other people's cars, and it just makes me nuts, because it's just like I have respect for other people's cars. But I've always had like pickup trucks before and everything like that, and my pickup truck would have like a bunch of dings on the side of it because people would just open and hit the door, and it's so annoying, so it's just like with everything else that happened today, just having that happen, it was just like, oh my gosh. So that was my day today. And the fact that I could still have a smile on my face, just, I know everything's going to be okay, but still, that was enough to just annoy me, because I can't stand when people don't pay attention when they're driving. It just irritates me so bad. But like I said, my car's okay. I'm okay. So thank goodness. I did want to bring up one question. So I have a wonderful viewer who always sends in the most thought-provoking questions for Q&A Tuesday. And I did forget to mention her one question that she did have. So I'm going to go ahead and address it now before I start with Urology Q&A. Her question was, when you first start out as a medical coder, do you get training on the different insurances and what codes and modifiers to use? So it depends on what your function is. So for me, my function in my facility is that I am a coder. We have a separate billing department that they deal with the insurance company. They deal with everything that goes on there with that. The only time things get kicked back is if they need me to review something and see if I need to select another diagnosis or I need to select another procedure. They're generally the ones that are dealing with the insurance company. So normally, you're just going to be going by your own, what you see in the documentation, and you are going to be applying the codes and the modifiers as necessary. There are some facilities that do not use all the modifiers, so that you will probably get training on. If you are in a facility that is, like I said, with a separate billing department, they're going to be able to take care of all of that for you. But it is important to know, usually like in the encoder, sometimes like these edits will pop up and it'll tell you like specific insurance companies and what the limits are for them. So that is how I learned some of what I know as far as like the insurance company goes. Some of it I have done research on my own, because when I kept seeing those edits pop up, and I'm like, okay, well, let me look into their particular insurance and see what's going on here. So that is part of clinical documentation improvement, as far as like letting your providers know that if a patient has particular insurance, there's gonna be a certain cap after a certain point. Allergy testing is one of the ones that I can think of off the top of my head, because there's a cap on some insurance companies. There's a cap on the allergy testing, so this is important for the provider to know. So just one of those things. again, it's going to depend on what facility that you're in. But it is always a good thing to look at different insurance companies and see if they have little quirky things, so that way you can be aware. Okay? So let's go ahead and get started with Urology Q A. Over the last month, and I say month because it's been about 4 weeks, I've had quite a few urology coders reach out to me, which I'm grateful for. Thanks, guys, because this lets me know what you're thinking about and what is most pressing for coders out there. Because of course, my head is always in orthopedics and podiatry, but I do like to code urology. I did help out with urology a few years ago. My coworker and I, she had invited me to come with her because she was like, "Oh, can you come with me? Because I get real nervous when I do a class." And she was doing one-on-one, but it was with a couple of the providers. And she's like, "Can you come with me?" I was like, "Oh, you sure?" She's like, because I know you like to do this kind of stuff. And I'm like, "Oh, yeah, and it's no problem." And I was helping her out, so I already knew the clinic anyway. But when I went there, it was a really good meeting, and a couple more providers. So we had like about 3 or 4 providers that showed up. So it was really nice to be able to have that sort of good chit chat and things like that. And it really did help because they were able to see what it is that we were looking for. That's what they were wondering that was most pressing for them. And then we wanted to clear up a few things as far as like making it clear on what else is going on with this patient and what are they treating, and what else is affecting their care. That plays a big role into it. Sometimes when providers are talking about like if they have anything in urology, right? And let's just say they have diabetes. Now, that diabetes can affect a lot of things about a urology patient, right? So let's just say, for example, and I'm just going to go ahead and dive right in, erectile dysfunction. If a patient's blood sugar is really high, right, their A1C is really high, there's a good chance that they can suffer from erectile dysfunction, or it can affect their ability to have an erection. Okay, when it does, the provider needs to state, especially if they're reviewing their blood sugar levels and their A1C and things like that. If they're looking at it and saying they're seeing that this blood sugar is high, that affects the erectile dysfunction. Now, erectile dysfunction can be either it can either be a chronic condition or it can be an acute condition. It depends on the underlying cause, okay? If it is related to something emotional or something physical. These are the things that play into it. All of the conditions that are affecting that patient with erectile dysfunction, like diabetes, obesity, depression, being over the age of 50, high cholesterol, smoking, alcohol use, drug use. These are things that are affecting that patient with ED. If it does, the provider should document if he's addressing these conditions, and even if he's not treating them actively, if it is affecting his medical decision making. Because remember, that evaluation and management level is the mark of their cognitive work. Okay, if he is having to consider all of these other conditions, their medications that go along with these conditions, and whether or not these conditions are stable, then he should be documenting it. So, or she should be documenting it so that we can get a fuller picture of what's going on with this patient, because all of these things factor into why this patient has this condition, or it could possibly affect this patient with this condition. So that is something to think about. And this goes back to clinical documentation improvement. What is affecting this patient? Because sometimes providers, they say, well, I'm not their primary care doctor, I'm not treating them for their diabetes. No, but that diabetes is affecting their ED, or it is affecting their BPH, or it is affecting, whatever other condition is going on with this patient. Their medications also affect their ability to care for this patient. If the patient is a urology patient and they have like anticoagulants, right? If they're on long-term use anticoagulants and they have hematuria, where there's the blood in the urine, okay, that is something that is like, hello, we got to look at this as well. So make sure that you're looking at all of those things, because all of these things are being factored into their medical decision making. Now, how do we do the sequencing? Okay, always consider, what is the patient coming in for? That is going to be your first thing right away. Because obviously, we're not going to put diabetes, even though diabetes is a chronic and serious condition, that's not going to bring them into the urology clinic. Okay, the urology clinic is something there's something else going on in the urology system. So we need to make sure that that condition is going to be sequenced first. So if they're coming in because they have BPH, and then they're coming in because maybe they're suffering from ED, that BPH, it depends on what are they doing for the BPH. Are they ordering additional workup? Are they adjusting their medications? Are they putting them on new medications? What is it that they're doing? And then if they say, oh yes, we have erectile dysfunction as well, that could be sequenced second, or it could be sequenced first, if whatever's bringing the patient in there is going to be the first up listed. Okay. So if it's BPH and then they come in and they start talking about the erectile dysfunction, you're going to start with the BPH, because that is what is bringing the patient in there. That is the primary reason that they're coming in for their visit, is because they need to discuss the BPH and what other symptoms they have, whether they have weak urinary stream or whatever else is going on with this BPH that is tied to that BPH. So that's going to be sequenced first, followed by, like in this example, the erectile dysfunction. Now, if it is erectile dysfunction and then they're having high blood sugar, the diabetes is out of control, you're going to sequence that diabetes out of control next, okay? If they have obesity as well, if the provider says, well, part of your problem with this erectile dysfunction is maybe, you put on so much weight that can affect you, or it is affecting you, depending on however the provider is saying it, then you're going to sequence that next, because, that diabetes is going to outrank that obesity, okay? So think of it in terms of that. If they have high cholesterol, okay, it's high cholesterol and obesity is pretty much running about the same, in my mind at least. But again, it goes back to how the provider is documenting what's going on with this patient and how severe are these conditions. If their high cholesterol is stable, like it's still the same, their cholesterol is still the same, but it's like high, and the provider says that it's stable, that's a condition that is stable, okay, and chronic and stable, because high cholesterol can be chronic. That's just something that you got to look at. Make sure that you're working with your provider on letting them know if a condition is stable. You need to say that it's stable. If it's out of control, even if they're not the active provider for it, it is still affecting them if they're using that diagnosis in their medical decision making. Obviously, they can't give a steroid shot to a patient who is, I don't know why you would give a steroid shot to a urology patient, but I'm just saying, if they're having to give them a steroid shot, right? They can't give a patient whose blood sugar is out of control a steroid shot. Why? Because it's going to spike it even more, because steroids can spike blood sugar, even in a normal patient who doesn't have diabetes. This is something to understand and know. Diabetes is very serious. Obesity, very serious. High cholesterol is very serious. And so is like depression and PTSD, which can also affect a patient who is suffering from ED. So erectile dysfunction can be both acute or it can be a chronic condition. It's depending on the underlying reason, okay? What if it is physical or if it is emotional? Like I was talking about with the depression, or if they have PTSD. These are things that, can affect a male's, ability to sustain an erection. These are very serious issues when it comes to, urology. That is one of the things that you need to make sure that the provider is documenting everything that's going on with that patient very well. And if it is a chronic condition that the patient has, is it stable? Is it worsening? Is it, are you having to order additional workup? These are all factors in that medical decision making. And when you're looking at your medical decision making, that is where, your evaluation and management is going to come into play. And how high is this level going to go? Because how much cognitive work is that provider putting into that patient? So I know it's a lot. Tomorrow, for Quiz Friday, I am going to be talking more about urology because it does get to be a lot with these scenarios with urology, because you have to think about what is bringing the patient in and how is it going to rank from there, like all the diagnoses that they have. So the more practice you get with it, the better. And my exercises are not official. These are just me as a veteran medical coder sharing the things that I know. Because like I said, I did do time with urology. So, and once you start having exposure to multiple clinics, it's easier to get back in it and to look at it because, as I mentioned, a lot of people have talked about urology lately. So it's good that everybody's reaching out. I am so glad about that, because having that open communication about what specialties are most pressing to most coders is very important, because to me, I would be off in La La Land with orthopedics and podiatry. But moving right along, so it is important to understand and know your acute and chronic conditions. UTIs are generally acute conditions because that can clear up. And like I said about erectile dysfunction, it depends on what is the underlying cause of the erectile dysfunction, whether it is acute or whether it is chronic. Sometimes if a patient is suffering from grief, they can suffer from erectile dysfunction. That is something that, if the provider knows that the patient is suffering maybe from grief and they have this issue, are they seeking treatment for it? What are they doing? What are the steps they are doing to sort of work and cope with their condition? So those are the things that you're going to be looking for in their documentation. So let's see, what else? Okay. Oh, talk about the audits. All right. So when it comes to audits, I've talked about audits before on another episode. I did a whole episode about audits and what to do in an audit. The first thing I want to say is this. When you are getting audits, and every medical coder will go through audits, okay? Every one of us will go through audits. Audits is not a bad word, okay? It is literally just what they're doing. They're auditing to make sure that you are selecting all the appropriate codes and the procedures and everything else. The auditors are there to help you. Try not to take what they say as a personal attack, because it is not meant as a personal attack. Hopefully the auditors are telling you in a way that is helping you to understand why they saw this error. Now, they're human too, okay? So they make mistakes as well. If you find that the auditor counted you wrong for something and you are in fact correct, and you can prove by way of a legitimate resource, okay, meaning like a coding clinic or something from the guidelines from the book, things like that, not just some willy-nilly website, okay, that says that you are correct. that there's actually something that is concrete and proof that you can give to your auditor to support your argument, then yes. But if you are just saying, well, I feel that this is this way, or I interpret it because this way, that's not good, because you don't want to argue unnecessarily with your auditors, because they are trying to help you to understand why they got a different answer from you. Hopefully, they are telling you why, or they're showing you a resource as to why. Most auditors that I've had have always given me a resource as to showing me why they are correct. It's never been, well, I'm correct because I say that I'm correct. It's never been that way, at least for me. It may not be that way at your facility, but, at the same time, it just depends on where you are. But the auditors are there to help you understand why you got it wrong. Their job is to make sure that everything is correct. They have a job to do too. And so try not to take what they say personally. And if you know that you are wrong, accept it and learn from it and move on. That is my biggest bit of advice when it comes to audits, because I've seen people try to sit there and argue, and they know they're wrong. They're just going to continue to argue because they just do not want to be wrong. Nobody wants to be wrong. I don't want to be wrong. Nobody wants to be wrong. But sometimes we are wrong. And sometimes because auditors have had exposure to seeing a lot of different codes and coding styles, they do know a lot. But like I said, sometimes, they get caught on mistakes as well. But if you have a solid argument, then yes, submit your solid argument. But if you're just saying it because you want to just continue to argue and you don't want to be wrong, then you are in the wrong. Okay? Now, I'm being real with you. This is real talk, okay? And I know my real talk is not very popular sometimes, but that's okay, because I'm being honest with you guys. I don't want to sugarcoat anything. I want you guys to be able to understand why these auditors are, if they're marking you as wrong on something, use it as an opportunity to learn, okay? Yes, we don't want to be wrong. And I've said this many times just within the last 5 minutes. We don't want to be wrong. But sometimes we are wrong, and if we can learn from a mistake, we can learn from a mistake. My supervisor, she told me a few months ago, she's like, you know what I like about you, Blue? She said, I can mark you as wrong, and I'll see that you'll never make the same mistake again. And I said, yes, because I can learn from what you tell me. Sometimes when I see that stack of audits, I'm not excited about it either, because I think, oh, she got me on something. Because it is possible sometimes when you're going through audits or you're going through records and you're like, oh, shoot, I forgot to grab that, or I didn't think about that, or I didn't see that when I was going through the documentation, I didn't see that. So sometimes it does happen. I try not to let it happen. My accuracy level is pretty high. But on the times that I am wrong, I have to admit it, I'm wrong, and so I try not to be wrong, but this is where all of the other investing time in education has helped, okay? So if you are being marked as wrong, take it as a learning opportunity. Learn what you can, and if it is a technical issue like with coding, then review the guidelines for that particular clinic. Review the guidelines not just for ICD-10, but also for the CPT as well. Look, and I'm talking about outpatient, okay? If you're inpatient, review your inpatient. But review the guidelines and make sure that you're remembering in the future, okay, to not make the same mistake again. If it is a pathological issue, like it's having to do with the body, there's something that is tripping you up, be sure to review that particular condition and make sure that you understand it forward and backwards, okay? You got to understand this stuff forward and backwards until you can recite this stuff like verbatim, I'm not telling y'all to memorize stuff, but just read it, because your brain has this wonderful ability to be able to look at things and be able to soak in all this information whether you realize it or not. So sometimes when you're just looking at a page and your brain is soaking in all of this information, even though you're not really reading it, your brain is still soaking it in. And sometimes you'll surprise yourself, because I've done this where I've like looked at documentation and or looked at articles and things like that, and I'll say, I remember seeing that somewhere, and I was able to retrace my steps and find out where did I see it, because my brain saw it, even though I'm thinking about something else, or I'm thinking about the coding, or I'm thinking about this or thinking about that. My brain still saw it. So this is where you have to sort of trust your mind and trust your brain, because your brain is a magnificent thing, okay? But you have to be able to apply it. And don't get overwhelmed, okay? That's another thing. I always say this all the time. It is easy to get overwhelmed, okay? But when you start to break things down, like little by little, and I'll give a good example of this tomorrow on Quiz Friday, with diagnosis selections. So if you're looking at a diagnosis and you think, how in the heck am I going to find this in the book? If you can't find it in the book right offhand, because you're looking at the location first and then you're followed by the action word, you're going to look for your location. Now, if your location is written in a certain way and you need to think of it in another way, think of other words that are similar to that word, okay, in particular, so that way you can try to look it up that way, okay? There's many, many different things, and in tomorrow's episode I will talk about that further, but get long-winded. But I hope that this has helped you guys in some way, and I'm going to leave a link to a website called urologyhealth.org, which is a wonderful website. It talks about different urology conditions, and it is a really good resource. So when you have these resources, be sure to look at them and make sure that you're reviewing the website, and so that you can understand, because these are actually the specialists that are involved in these websites. They're talking about these conditions, and these are the guys that are women that are working constantly in this field. So you want to be able to look and see what they have to say. So I will leave that down in the description box below. But I think that is it. Yes. So that wraps up tonight's episode. Again, tomorrow I'll be back for Quiz Friday, and I will be putting more urology procedure coding tomorrow. I'm going to make it more of a point to do a lot more procedure coding, because I've been asked a lot for procedures, and I'm glad you guys are asking me for specifics, because at least this way I know what specialty to concentrate on and what is tripping you guys up most. So yes, but I will go ahead and close it up tonight. So if you guys have any questions for Q&A Tuesday, be sure to submit them. There's still time, and I will put them on the list for next Tuesday. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all on the next episode. Bye!